and welcome to SureenaSpeaks. And with the election looming in a few days' time, I thought it'd be worth making a video based on some of the party's manifestos and what it means in relation to pharmacy. Now, there have been many debates and updates on the manifestos and what it means in relation to the NHS, but I wanted to make this video specifically to what it means with pharmacy and how it might affect pharmacists. Now, first and foremost, I myself am still torn about who it is that I am voting for, so I'm going to try and keep this as unbiased as I can. And what I'm going to do is I'm going to read out statements and extracts from various manifestos and then give my questions and queries and opinions on what I have of those different extracts. What I'm not going to do though is tell you which party that manifesto relates to. Now, don't worry, I will write it in the description box below for you, but as I'm reading it, and especially if you're torn as well, it might be quite refreshing to almost have a blank canvas and just hear a bunch of statements and see if you agree with them, if you disagree with them, and what your thoughts are on them. Now, depending how much you've been following this, you might be able to capture and gather which manifesto is relating to which party, but like I said, I'll write it in the description box for you below anyway. And another thing I want to say is that, firstly, it's really important to vote if you can vote. If you are eligible to vote, please do so. And secondly, please use your vote wisely. So what I'm going to be saying in today's video, don't just take extracts from that and think, oh yeah, I agree with what's being said in this particular extract, so I'm going to vote for that party. I do strongly recommend that you read the manifestos as a whole and take it from there about which party it is that you agree mostly with. So without further ado, let's start off with what I'm going to call Party A. So Party A, this party pledges to stop the taxpayer being ripped off by pharmaceutical companies, but it doesn't actually give any more context into how it's going to do this. The party says that there would be no privatisation of the NHS, and it promises to introduce 24-hour GP surgeries to relieve the strain on A&E. Now, does this mean that there's going to be an increase in 24-hour pharmacies? Because presumably, if there's an increase in 24-hour GP surgeries, that means that there's going to be more patients with prescriptions, and say, for example, it's an antibiotic, that's going to have to be dispensed pretty soon. So, again, I ask the question, does that mean that there's going to be more 24-hour pharmacies then? This party believes in continued investment in the NHS, better management, increasing the number of medical staff and cutting waste. But how many medical staff? And does this mean pharmacists? Are they included in that? Or does medical staff mean GPs and nurses or doctors and nurses? It's all a little bit vague. And this party says to abolish all politically imposed hospital targets that distort clinical priorities. But again, there's no further details. So that was Party A. See if you agree, disagree, or don't really know how you feel about it. And you won't be alone if you're in the don't really know how you feel about it, so don't worry about that. So Party B, their manifesto states, we will increase expenditure across the health sector by an average 4.3% a year. This investment enables us to end patient charges, so they will abolish prescription charges in England, and it guarantee the standards of healthcare patients are entitled to receive from NHS England, invest in education for the health workforce, and restore public health grants. Sounds good, but is it viable? It goes on to say, to support our transition to community healthcare services, we will expand GP training places to support resources for 27 million more appointments each year and ensure community pharmacies is supported. So community pharmacy gets a shout out here, woo! But how will they be supported? There's no detail or expansion in this, so a little bit vague. We will, party goes on to say, we will establish a generic drug company. If fair prices are rejected for patented drugs, we will use the Patients Act provisions, compulsory licenses and research exemptions to secure access to generic versions. And we will aim to increase the number of pharmaceutical jobs in the UK. So essentially what this is saying is that this party wants to introduce a generics drug company, which will be state-owned and essentially at affordable prices it will sell medicines to the NHS. Now, a generic drug company can't just pop up overnight. So realistically, when will this actually come into play? Again, big question mark. Manifesto continues. It says, we will ensure that all parts of the NHS, the treatment of patients, the employment of staff and medicine pricing are all fully excluded and protected from any international trade deals. So that's pretty self-explanatory. And they say, we will progress clinically appropriate prescription of medical cannabis. Now, does this mean that there'll be changes to prescription requirements regarding cannabis? Again, we don't really know yet. Now let's go on to Party C. So in their manifesto, they say they want to end the GP shortfall by 2025 by both training more GPs and making greater appropriate use of nurses, physiotherapists and pharmacists. So again, pharmacists get a shout out. Woo! And also phone or video appointments where clinically suitable. So they want to do more of that. Now, if it's via phone or video, has there any thought gone into how the individual will then get their prescription? Will the process be as it is now? And yeah, there is a shortfall of GPs, but there is also a shortfall of staff members in pharmacy teams. So has this actually been thought about and has this been accounted for? The manifesto continues. They want to support GPs, nurses, physiotherapists, mental health and other professionals, I'm guessing pharmacists are other professionals, to work together across their local areas to provide multidisciplinary health and care services to improve appointments outside of normal working hours, including mobile services. Quite self-explanatory. They continue to say they want to review the NHS's future needs for all staff and produce a national workforce strategy, taking a long view and matching training places to future needs. We need to do more to retain staff as well as to train them. We will take a what works approach to improving retention, including continuing professional development, so CPDs, better support and more flexible working and careers. They still help to retain staff through more flexible working so that we never again experience a shortage of the GPs, hospital doctors, dentists, nurses and other professionals that the NHS needs. We will listen and act on the pensions crisis that is driving away our most experienced clinicians and worsening waiting times and the workforce crisis. Now, with this party, on one hand, they're saying that they want to improve appointments outside normal working hours, which is a great thing for patients. But on the other hand, they're saying they want more workable or flexible working careers for those in the NHS. I don't know how the two can be accommodated, if it can be accommodated. Great if it can be, but how? Continuing. So this party says they want to introduce a new requirement for professional regulation of all care home managers, who would also be required to have a relevant qualification. For care staff, we will set a target that 70% of care staff should have an NVQ level 2 or equivalent. Current levels are around 50%. We will provide support for ongoing training of care workers to improve retention and raise the status of caring. That's quite self-explanatory. Cool. So they say they want to introduce a new statutory requirement for public health interventions evaluated as cost-effective by NICE to be available to qualifying people within 3 months of publication of guidance. They go on to say to move the departmental lead on drugs policy to the Department of Health and Social Care and, crucially, invest in more addiction services and support for drug users. So, with that in mind, will this then change or affect the relationship that there already is between the drug and alcohol clinics and particularly community pharmacies? We don't know. This manifesto continues. The funding promised to the NHS, which includes a ring-fenced £7 billion per year, raised through a 1p increase on income tax. Self-explanatory. They want to make prescriptions for people with chronic mental health conditions available for free on the NHS, as part of our commitment to review the entire schedule of exemptions for prescription charges, which has not been fully updated since 1968 and contains many anomalies. So that was Party C. So I want you to think about whether, with the parties that I said so far, which of the extracts do you agree with, which of the extracts do you disagree with, which of the extracts actually pose more questions than answers. So now Party D. Now Party D are saying that they want to have 6,000 more doctors in general practice and 6,000 more primary care professionals such as physiotherapists and pharmacists, get another shout out, This is on top of the 7,500 extra nurse associates and 20,000 primary care professionals that we have already announced. So they want to get 6,000 more primary care professionals, but they've not actually stated how many of these will be pharmacists. Will 1,000 of that 6,000 be pharmacists? Will 2,000? Will 3,000? Will it be only 100? We don't know. This manifesto then goes on to say that 6,000 more doctors will be recruited and creating an extra 50 million general practice appointments a year. Now this sounds good, but the number of pharmacists to then dispense these prescriptions also needs to be accounted for. Pharmacy teams are already so short-staffed, so has there been any consideration into how these pharmacy teams will be supported with this? So aside from the vague 6,000 more primary care professionals being introduced, we do need more dispensers, we need more pharmacy technicians, we need more accuracy technicians. Has this been accounted for? Has this even been thought of? A few times throughout this manifesto is as follows. The NHS is not on the table, the price the NHS pays for drugs is not on the table, and the services the NHS provides are not on the table. Now it states that, but it has been claimed that another party, that they have actually seen leaked documents which state that this particular party and the US have been in trade talks about the NHS. Who knows if it's true, who knows if it's false, who knows. But yeah, that's what they're saying. And now moving on to Party E. Now, before I go into this one, just to pre-warn you, it does talk a lot about cannabis. So, an extract from their manifesto. Make heroin available on prescription after a medical assessment by a doctor and provide safe facilities for users who inject drugs, building on the success of drug consumption rooms in other countries which have encouraged more problematic drug users into treatment. Now, will pharmacists have more of a role in this, in the care and the support of these drug users? Will pharmacists play a part in this? Will they have a role in this? Again, it's a question mark. Again, another extract from this manifesto. This party, they want to regulate access for adults to stimulant and psychedelic drugs based on the evidence around harm reduction through pharmacies, after a safe consultation with a qualified pharmacist at fixed doses and fixed prices. Well, I mean, pharmacists are known for being legalised drug dealers, but what if the pharmacist doesn't feel comfortable having such a consultation? What are the legal and ethical implications of this? Continuing, the following extract. This party says they want to make cannabis labelled according to laboratory tested strength available to adults from licensed small businesses. Cannabis will be sold subject to minimum unit pricing and plain packaging. Again, I ask, will pharmacists play a role in this? Will they be selling it as well, or will it be just licensed small businesses? This particular party, they want to set up an independent statutory body, the Advisory Council for Drug Safety, comprised of experts who will be responsible for monitoring patterns of drug use, advising the government on changes to regulation, and sourcing socially and ecologically sustainable supplies of opium and coca from the global south. Now, will pharmacists play a part in this? Will they form part of this council, for example? I mean, I personally believe they probably would have quite great insight into forming or being part of this council. Continuing, this party says that they want to replace private sector involvement in the NHS with community leadership. We will allow local authorities to lead a bottom-up process, and services will be planned and provided without contracts through health boards, which could cover more than one local authority area if there were local support. And finally, they state, we will ensure that all forms of birth control are free to give women a real choice of the birth control that works best for them. My question is, does this include emergency hormonal contraceptives? Presumably it does, because they've said that it'll be all forms of birth control. But again, probably need a bit more clarification on that. So those are parties A to E. Now, bear in mind that there are other parties with other manifestos, so please do have a look at those too. And as mentioned before, I will write which party each of those letters do actually relate to in the description box below. But I hope that with this in mind now, listened to those extracts and thought, oh yeah, maybe I agree with that, maybe I disagree with that one, or maybe this one just has too many question marks and I don't really know how I feel about it. And the ones that I did choose, those parties A to E, I tried to choose the parties that had mentioned pharmacy or pharmacists or had quite a lot of information in their manifesto regarding medicines. So that's how I chose those ones. But like I said, there are other parties, there are other manifestos, so please do have a read of them. Don't just take what I said today as being what you're going to go with. These were just extracts that I've taken and I've given my opinion on them, but please do your research too. And as I said before, if you can vote and if you are eligible to vote, then please, please do so. You have a voice. This is your chance to use it. And please vote wisely. This is a really prominent time that we're living at the moment, and undoubtedly in the future people will be learning about this in history lessons, and we're actually living through it right now. So you have an opportunity to actually shape things and potentially shape our future. So please, if you can vote, and I will keep saying it, if you can vote, please, please do vote, and please, please do vote wisely. So I hope you liked this video. I hope it gave you a bit more insight and information, and if you did like it, why not give it a thumbs up? Share, like, subscribe. Do also visit my Facebook, Instagram and Twitter. And until next time, thank you for your time and happy watchings.